Hello everyone, welcome to the series on medical emergencies in dental practice. This is the first video of the series where I will take you through the commonly encountered medical emergencies in dental practice. It will be an introductory video, and further in the series we will take a deeper look into each individual situation and how to manage them. Starting with syncope, this is the most commonly encountered situation in dental practice. It refers to the transient loss of consciousness caused by reversible disturbances in cerebral function. It may occur due to inadequate cerebral circulation, changes in the quality of blood perfusion to the brain due to metabolic derangements, alterations in the part of central nervous system that regulate consciousness and equilibrium, and emotional disturbances. Next on the list, seizure. It is characterized by paroxysmal excessive neuronal brain activity and an abrupt onset of motor, sensory or psychic symptoms. The seizures may present as simple partial seizure, complex partial seizure, tonic-clonic seizure, absence seizure, and status epilepticus. Coming to acute hypoglycemic shock, it occurs when there is sudden fall in blood glucose levels below 50 mg per dl in adults and 40 mg per dl in children. Non-diabetic hypoglycemia is related to oversecretion of insulin by pancreatic beta cells due to increased insulin requirements. This may occur in case of prolonged anesthesia, when the patient is empty stomach or there is a delay in next meal, or in case of anxiety. Hyperventilation refers to ventilation in excess of that is required to maintain normal arterial oxygen and carbon dioxide tension. It is produced by an increase in the frequency or depth of respiration or both. The common causes include extreme anxiety, pain, metabolic acidosis, drug intoxication, hypercapnia, cirrhosis, or organic CNS disorders. Next, allergic or hypersensitivity reactions may present as type 1 to type 4 reactions. Of particular importance to dental practice are type 1 or immediate hypersensitivity reactions and type 4 or delayed hypersensitivity reactions. Next, coming to angina and acute myocardial infarction. Angina refers to spasmodic, cramp-like choking sensation or suffocating pain, while myocardial infarction is a clinical syndrome characterized by severe and prolonged substernal pain caused by cardiac ischemia and damage to myocardial cells. Next, acute asthmatic episode is characterized by shortness of breath or wheezing. It occurs in patients with history of asthma and may present as reversible respiratory smooth muscle spasm or irreversible airway inflammation with edema and mucus hypersecretion. Now, coming to foreign body airway obstruction. It occurs when the aspirated object enters into the tracheobronchial tree. This may result in complete or partial airway obstruction. Also, aspiration of gastric contents into the lower respiratory tract can lead to serious respiratory difficulties due to the low pH and particulate matter. The low pH of gastric content can necrotize the pulmonary tissue, resulting in transudation of fluid into the pulmonary alveoli and loss of lung tissue. The particulate matter in gastric content can cause physical obstruction of the pulmonary airways. Acute adrenal insufficiency. It is a potentially life-threatening condition that can occur in patients undergoing stressful dental treatment and having little to no adrenal function. The adrenal function may be compromised due to primary adrenal insufficiency or secondary adrenal insufficiency. Now coming to thyrotoxicosis and acute thyroid storm. Thyrotoxicosis may result from excessive production of endogenous thyroid hormone by the thyroid glands or excessive administration of exogenous thyroid hormones. On the other hand, acute thyroid storm or crisis occurs in case of untreated or incompletely treated thyrotoxicosis. It presents as an acute life-threatening situation with severe hypermetabolism, including high fever, and dysfunction of cardiovascular, neurologic, and gastrointestinal systems. And in the end, local anesthetic toxicity. It occurs when the action of local anesthesia extends to excitable membranes other than the peripheral nerves, such as those in the heart, brain, or neuromuscular junction. This occurs when the local anesthetic exceeds the maximum recommended dose, such as in case of accidental intravascular injection, administration of a large dose, or rapid rate of injection. That's all in this video. In the upcoming videos, I will explain these emergency situations one by one in more detail. Till then, do like, share and subscribe to our channel. Also, you can download our app for more details and notes on dental and medical topics.